So hello and welcome back to the Oral Health Podcast. In connection with National Smile Month, we are here bringing you bite-sized discussions with leaders in dentistry about different oral health topics, and we're covering a different topic every session. So today we are focusing on taking care of your gums. This episode of the Oral Health Podcast is sponsored by Corsidil. Corsidil toothpaste helps stop and prevent bleeding gums. Add Corsidil toothpaste to your daily brushing routine to help stop and prevent bleeding gums. It could have a positive impact on your overall oral health. So let's just get straight back into today's topic. I'm back here again with Dr. Ben Atkins, who's the Oral Health Foundation's president. How are you, Ben?
I'm brilliant, Sophie. How are you?
I'm really good, thanks. I'm excited to actually get discussing this today because we did the last episode on taking care of teeth, and you mentioned things like gum pockets, and it sort of made me go, oh, what on earth are they? So I went and had a little look, and so do you want to why don't we get started talking about gum pockets, and then we'll go into more general gum health advice. What exactly are gum pockets?
Okie dokie. I think if we take it right back to beginning, there are things that patients often don't quite get with teeth, which sounds a bit odd because that's my job. So I've failed them as a dentist. My job is an educator, but I'll take the glory in a second. So teeth are the only thing, which is why it's so important, that perforate from the outside of the body to the inside of the body. Okay, so if you imagine the rest of your body, there is nothing else that creates this tube, which bacteria and things can get into your body and cause quite a lot of damage, which is why my profession is around, really. We're there to make sure your teeth and your gums are really healthy and there's no problems. So the teeth are held in place by little ligaments, very, very, very small ligaments, which hold them into the bone. And they're called the periodontal ligament. Okay, that creates you've got a tooth where you can see the big white thing hanging into your mouth. The top of those is some gums. And basically the root goes often 2 to 3 centimeters up into the bone. So it's not small, a tooth. People are often shocked when we take a tooth out because it's almost like an iceberg. The majority of it's actually in your bone holding the tooth in place, because let's face it, you do some quite crazy things with your teeth and you chew things, and you know. So the periodontal ligament is the thing that anchors that tooth into the bone. So it's really important you keep your gums really, really clean, because then you don't get any bacteria attacking that ligament. And when that ligament starts to get damaged and disappear, they can create little pockets around your teeth. And that's the pockets I was referring to the other day. I got rather excited. What's a pocket then? What's a pocket? But it's really complicated, but actually a very simple anatomical thing. Because that's why, let's face it, dentists and people who study gums, periodontologists, are so fascinated by this interconnection, because it's a fascinating environment, the body, and to manage that biofilm, or the good bacteria and the bad bacteria we all talk about in your body, it is critical to keeping a healthy mouth and those gnashes in place. So it's really important.
So when you're getting your dental check and you're in the chair and they're going through and they're shouting out different numbers, so I've often lay back and went, okay, are they counting my teeth? Like, what's going on? So what do those different numbers generally indicate?
It's a really good point, Sophie. So I chat to my patients and I tell them, if the number gets to 4, you worry about it. Okay? So once we've charted the teeth, ignoring the 1, 2, 3, 4, 5, 6, or 1, 1, 1, that sort of stuff. When we start looking, the dentist or therapist or hygienist starts poking around at your gums. See all the technical terms coming out now. Poking around at the tongue, the gums, and they start talking about 0, 1, 2, 3, 4. A 0 means everything's fine and dandy. A 1 means there's a little bit of bleeding. A 2 means there's a bit of bleeding and a little bit of that tartar stuff, which we then scrape off. And 3, you started to get little pockets, and 4 is when you start to get a condition that we want to control and jump in and really monitor. Periodontal health, there's 3 or 4 different categories that we talk about our teeth. So there's periodontal health, where you've got healthy teeth, healthy gums, and that's less than 10% of your teeth bleeding. So if you've got less than 10% of your teeth bleeding and you've got no attachment loss, none of those ligaments have disappeared, or no bone loss between the teeth, that's periodontal health. You're all right. You start to get between 10 and 30% bleeding, that means you've got gingivitis. Now, gingivitis is, the gingiva is a posh name for the gums, the pink area. So itis means swelling. So gingivitis. So you can get the terminology. Gingiva is the gum, itis is swelling. That's where you get the bleeding. That's between 10 and 30% bleeding. And if you get greater than 30%, it's a general gingival condition. So I'm trying to put dental talk into normal words because it's quite challenging when you hear all these numbers. Yeah. So gingivitis, majority is reversible back to periodontal health. So that's what we work with our patients. That's why it's really important. You see any bleeding in your mouth, make sure you clean that area. It's quite funny because the mouth is different. If you cut your arm and you see bleeding on your arm, you don't start rubbing it. You do with you. If it's around your gums, you want to brush those areas more.
Okay.
What you're doing is you're removing that plaque and you're giving it a chance to heal throughout the day. So you just cleaned it. And talk to your dentist about introducing maybe some colourful toothpaste or something along those lines. If you see bleeding on your gums, go and see your dentist or your therapist or your hygienist and say, look, what's going on here? I've noticed a bit of bleeding here. And they'll just teach you how to brush it better because our teeth change shape through our lives. They do. You get long in the tooth. It's a famous saying. And I say to my patients, look, I've had to change my brushing recently. I've got some really good videos, my children disclosing my teeth because they've changed shape, you know? So I've now got blue disclosing gel everywhere and they say, oh, come on, Daddy, we'll check you as well as you check yours. So those disclosing tablets are absolutely brilliant if you want to check your own teeth where I'm missing. I'm just a little simple test and we can take it from there. But for me, in being aware of your mouth, any bleeding areas is amazing for my patients to do. Say, Ben, I've been brushing between my teeth up here, the little interdental brushes, and it's been bleeding. So what I did then was brushed a little bit more. I upped it to morning and evening with little dental brushes. The bleeding went away. And what happens is the gum becomes tight and pink again. So it is reversible, but it's that early sign. If you catch it early, we're onto a real winner.
So it is reversible to an extent, like gingivitis and...
Gingivitis is. Once it's moved into periodontitis, you'll often find we're starting to lose bone and things through that. So that is irreversible. But if you're changing your oral hygiene, looking at factors like smoking, etc., you can get it to go into. It's difficult to use the remission word, but it goes stabilized because it can come back dramatically. So we sit down with our patients and say, look, oral hygiene is critical in this. And if a patient understands that, it's amazing. It's often my fault. I always take it on the chin as my fault. If my patient's got gum disease, it's the fact that I've not managed to find the way to educate them correctly. Don't get me wrong, I'm not taking responsibility for the teeth, but I'm saying that it's that I find it as a failure for me if I haven't got that message through. It's that's the battle. That's the fun behavioural change stuff that I'm so passionate about in my line of work.
Apart from the seeing blood when you spit your toothpaste out, is there any other indicators that you can sort of look for and think, I think I'm starting to maybe get some gingivitis, or I might be starting to develop some gum problems?
A bad taste. So if a really good thing to do is if you're going to use some like incidental brushes or some floss, smell it afterwards. If you've got a bad smell on there, you know something's going on around that area, and you're not cleaning it properly. But by 2 or 3 days, by cleaning it, it really, really makes such a difference if you're using it properly. So for me, doing that, bad breath. If someone ask one of your close friends if you have your bad breath, and that can be a really, really good indicator for it. Wobbly teeth. If you've got really bad periodontal disease, it is a difficult situation. You can get pain. There's a lot of different symptoms, but common sense says that if you've got bleeding gums, if you've got a bad breath, you can tell when a patient comes through the door, really, as a professional. If they start to list these symptoms, you're almost looking at the gums first. It's possibly one of the biggest challenges we have with our profession is changing these conditions, these oral hygiene journeys that have been embedded by someone, possibly your grandparents, who lost their teeth when they were 20 odd. How were they experienced enough to teach you how to brush your teeth?
That's a really good point.
Learning that journey and changing that route for oral hygiene. I've had quite a few periodontal patients who they were thinking they were going to lose all the teeth, but by brushing all the teeth, lost those teeth, everything tightens up a little bit, and suddenly they can chew again. And so oral hygiene is absolutely powerful. And that behavioral educational journey is the most satisfying thing about my job.
It sounds it. Yeah, you've raised a good point of there is a little bit of flaw, potentially a little bit of flaw, in the people who teach you how to brush your teeth not doing it correctly in the first place. It's like they say, don't learn to drive from one of your parents because you'll pick up all their bad habits. It's almost the same. Really quickly, is there anything different that you have to do to take care of your gums if you have something like braces? Is there anything different you need to do there? Because obviously a big chunk of the tooth is obstructed, for lack of a better term. There's probably a better term, but I don't know it.
No, it's a great term, so if it works for me. They are, but I think you've just got to take your time. I think you've got to take your time with your brushing. You've got to make such a big difference with your attachments, with your wires. And if anything's catching or digging in, you go back to your orthodontist and say it needs straight away because you've got a loose piece of metal and things in your mouth. For me, I would be brushing my brace as if it wasn't there. Don't be worried about it. If it comes off, then that's the orthodontist problem. And to be honest, the wire benders in our profession, I do say that tongue in cheek because they are magicians in what they do to teeth. I'm absolutely in awe of them, orthodontists in my world. However, their teeth need to be there at the end, so you must get very good oral hygiene. Electric toothbrush is an absolute wonder for that. I think they're amazing. And if the brackets keep coming off, I really don't mind. I want those teeth to be perfect by the time they take the brace off, and you get that payback of 3 years of a brace smile, which got off for about 6 months. So that's good.
Yeah. I remember when I had my braces taken off and I was just going around everywhere like smiling, like, have a look at my teeth.
I always call it that payback. It's amazing that you do have, you literally can't smiling. Can't stop smiling. You've been sort of hiding away for 2 3 years in my case. I was looking at mine the other week and thinking, oh, they're going a bit crowded on the bottom there. Should I get them straightened? If I don't get them done, who's going to? So we'll see. Watch this space.
Just very quickly, because as we mentioned, the this episode is sponsored by Corsidil. As a dentist, is there any, like, how are those products helping? Is there something in that isn't in a regular mouthwash that is going to help clean out the gum area, or like how is it actually going to help?
Using the Corsidil products is a really good helping tool in the journey for removing that inflammation. Now, also, we can then put specific medication into specific areas. It's really important to work with my patients to choose the right products. And Corsidil, one of those things, it's in my armory to help patients keep their mouth clean.
Well, we have discussed an awful lot about gums. You've answered all my questions about burning questions I had about gum pockets and what they are and what all that means. We've mentioned the difference between healthy and unhealthy gums, as well as went over the symptoms and causes of gum diseases and the different stages. So gingivitis, periodontitis. Is it periodontitis?
Periodontitis, yes, fantastic. See, inflammation of the periodontium. Periodontitis.
We've discussed it all, and how to keep gums healthy, so brushing interdentally. A tip that I'm going to take away is smelling the brushes after they've been used, even though it seems a little bit...
It's grim.
I was trying to think of a better word for grim, but we'll go with grim.
Yeah, because it's you suddenly get people going, I now know what I need to brush my teeth for.
And just very, very quickly mentioned things like braces and orthodontics, and if there's anything different that you need to do. The orthodontist will tell you is to take extra time brushing your teeth. I think I was told 10 minutes. Is that still about right?
Sophie, I'm far too old for that now. It's 30 years since I had my brace. But you know what? It's how long it takes.
But we have covered an awful lot today, and we are going to wrap up today's session here. Thank you again, Ben, for joining me. It's been fantastic. Thank you again to Corsidil for sponsoring this episode. We'll put all their information in the description of this episode if you want to go and have a look at their products. If you want to find the Oral Health Foundation on social media, we are on Twitter and Facebook at Dental Health Org, Instagram, Oral Health Foundation, and our website is dentalhealth.org. And so, yeah, to wrap up here, Ben, it's been fantastic, and thank you again for joining us. And then we will see you in the next episode.
Fantastic. See you soon.